India today reported a new daily death toll of over 4,000 and more than 400,000 new cases. It's the world's worst COVID surge.
One of the big questions facing the healthcare system in India is the supply of adequate number of medical equipment like ventilators and masks.
I'm joined by a very special guest who is joining me from the United States. Now, she's part of a research team that have developed and designed splitters for ventilators. It's of course very appropriately named iSAVE. Tell us more about this and how did you come upon this idea?
Sure. So last year when COVID hit the United States, physicians had reached out and basically asked for what's the best way to increase short-term capacity of respiratory care devices. And so we assessed all of the different options and then looked at this option, which for just a fraction of the cost allows you to double a CPAP, BiPAP, high flow oxygen therapy, or ventilator device to 2 patients with customized support for each patient so that that ventilation is safe.
During the crisis, we were working basically all day, all night. We applied for regulatory approval there. We built a network in India basically from scratch. In the end, really, we had our device in, I think, 10 hospitals to actually be there at the front line and support clinicians in the daily work.
At the height of the crisis in India, a lot of the feedback that we were getting from medical staff is that we need this right now, and we need a lot of them, and every hospital will need them.
This is going to be very helpful for us to tide over the crisis.
iSAVE really helped us getting additional manufacturers and potential distributors into our network. It's not enough to just have the technology and design it and develop it and test and validate it, but it's really the challenge is to implement. And the moment it comes to implementation, one needs 2 things. One needs funds and one needs a network of people who know how to do things that you can't do. From that angle, it was incredibly valuable to have iSAVE on our side.
I think the iSAVE experience helped us sort of reframe how we were thinking about moving into new countries. So we had launched in India in the height of the crisis, and we wanted to kind of rethink and reevaluate our strategy as we expanded to other countries. So being able to tell that story during the iSAVE process, and then also working with some of the mentors after to figure out what kinds of distributors should we be working with, what should be our manufacturing strategy. Those things have helped us as we move forward to expand into other geographies beyond India, which was really our beachhead market. We really want to find ways to bring these low-cost yet effective solutions to places that need them most to reduce that health equity gap. And that's really at the center of our mission at Project Prana.
I truly believe that building technology is one of the few ways you can do the 3 golden things in healthcare: increasing access to care, increasing quality of care, while reducing the cost. And engineering is really about coming up with creative solutions to reach that goal for us in the healthcare space, but I think in general far beyond.